It's 11 a.m. here in Seoul. I'm Oh Soo-young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the COVID-19 outbreak here in the nation. In just a few moments, we'll cut into the briefing room at the Sejong government complex with simultaneous interpretation available for you in English. Health Ministry official Yoon Tae-oh will be giving us details on the COVID-19 outbreak here in South Korea. He's going to update us on the number of new infections as of Wednesday midnight, as well as the efforts that the government is making in order to contain the spread of the virus. We are now soon going to go into the briefing room at Sejong government complex, and it looks like the official is about to take to the podium very soon. There he is, we can see him on the screen, and let's take a listen to what he has to say.
Let us now begin our regular briefing for February 3rd, Wednesday. As of today midnight, we have 433 new local infections and 34 new imported cases. And yesterday at the makeshift testing centers, we have identified 80 new COVID-19 cases. And yesterday we had 6 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. Here are some updates on our antivirus measures that are putting in force right now. Yesterday we have carried out about 73,000 tests, and 45,000 were tested with symptoms, and about 31,000 people have been tested at the makeshift testing centers. To this end, if you have any suspicious symptoms of COVID-19, we ask you to visit a nearby screening clinic to get tested as soon as possible. And as for the medical capacity, here are some details. We are seeing a reduction in the number of COVID-19 cases, and we are seeing increased response measures being put in force in our medical capacity. And we have about 405 hospital beds for critically ill patients, and we also have about 12,000 beds available for those with light symptoms. And also we have 0 patients who are waiting to get to the hospitals for over a day, and we also have enough numbers of our medical staff members who have been mobilized to the scene. And despite the cold weather, we would like to extend our deepest gratitude to all of the medical practitioners who are fighting against a virus at the forefront. And here are some special measures for our traffic means during the Lunar New Year holiday. During the Lunar New Year holiday, which is just around the corner, we ask the public to refrain from traveling and also visiting their hometowns. To this end, during the Lunar New Year holiday, we have provided a pan-government special efforts for our transportation. First of all, our aim is to decrease the amount of traffic during the Lunar New Year holiday. Just as we did during the Chuseok holiday last year, we will also only have the sales of tickets for trains in the window seats, and this will also be same for the ships as well. And as for the expressway toll fees, we will also be imposing them just as we did during the Chuseok last year. And at the rest areas in the expressways, you are also prohibited from consuming food as well. And also, if you are visiting these rest areas, we ask you to write a visitor log and also comply stringently to the quarantine measures. And also, we will be urging the public to utilize the different rest areas available to lower the amount of population as well as density. And at these rest areas, we will also carry out regular ventilation and disinfection, and we also will set up body temperature screening thermometers to also ensure that we have no COVID-19 patients. And we will also provide partitions to contain the further spread of the virus. And we will also be looking into the monitoring of the traffic during the Lunar New Year holiday. And we believe that this year's traffic will decrease from the previous year by over 30%. And once again, we ask for your participation going forward. And we also have response measures in place for the homeless shelters. And in January, we have seen numerous COVID-19 cases breaking out at such similar facilities. And to this end, in the Seoul metropolitan city, we have carried out testings for 7,600 people, homeless people, and a total of 98 confirmed cases were identified. And the government believes that there are still many people who have not yet been tested, and we will also expand the scope of our mass testings so that we can contain the virus going forward. And as for the people who, the homeless people whose residential areas are not identified, we will also make sure that they are traced as soon as possible. We will be intensifying our quarantine measures. On the other hand, we will also make sure that we provide necessary services for the homeless people. For instance, we will provide many services, including provision of meals, as well as other similar facilities and support. Once again, we underscore the crucial need for them to get tested, and also a stringent monitoring of these quarantine protocols for such similar facilities going forward. And thanks to your support in the COVID-19 social distancing measures, we believe that we are able to contain the virus to a large extent, and this is the largest weapon, the strongest weapon indeed, that we have at hand right now. We are having a prolonged fight over the COVID-19, and this has resulted in increased fatigue among many people. The government is aiming to carry out social distancing measures, striking a harmony between the quarantine measures and the daily routines. Yesterday, we had a panel of experts taking part in symposium and discussions, and we have evaluated some rooms for improvement, especially when it comes to the social distancing measures, and also its impact on the vulnerable class people, also including those who own the micro businesses as well as self-employed. And next Tuesday, we will also invite many micro business owners as well as self-employed to engage in these discussions. We will make sure that we will minimize any damages incurred to the public, and we will also seek new solutions going forward. Despite the dedication and sacrifice of many people, we are seeing a daily cases hovering around 400. And we have also seen the cluster infection lately stemming from the IM mission group. We believe that this has been contained to a large extent. However, we still have many other facilities that are prone to the virus infections, including detention centers as well as hospitals. We believe that we need to continue to exert and experience a sense of vigilance. And until we have a final control of the virus, we ask for your participation in the antivirus measures. And it is our utmost goal to help the citizens return to a state of normalcy. Thank you very much.
That was a government briefing you just heard on the COVID-19 situation here in the country. South Korea, as of Wednesday midnight, reported 467 new cases of COVID-19, reaching an accumulated total of 79,311 infections. There have been 6 more deaths from COVID-19, raising the total death toll in the nation to 1,441. We're going to wrap up the coverage here, but we will be back at 12 p.m. Korea time with our midday news with Mark Broom. Bye for now.